Handbook of Diagnosis and Treatment of DSM-5 Personality Disorders. Assessment, Case Conceptualization and Treatment. Len Sperry, MD, PhD. 3rd edition. Handbook of Diagnosis and Treatment of DSM-5 Personality Disorders. Since the publication of the acclaimed 2nd edition of the Handbook of Diagnosis and Treatment of DSM-4 TR personality disorders, much has changed in how the personality disorders are understood and treated. However, like its previous editions, this new edition is a hands-on manual of the most current and effective evidence-based assessment and treatment interventions for these challenging disorders. The beginning chapters describe several cutting-edge trends in the diagnosis, case conceptualization, and treatment of them. Then, specific chapters focus on evidence-based diagnosis and treatment interventions for each of the 10 DSM-5 personality disorders. Emphasized are the most recent developments from cognitive behavior therapies, dialectical behavior therapy, cognitive behavior analysis system of psychotherapy, pattern-focused psychotherapy, mindfulness, schema therapy, transference-focused psychotherapy, and mentalization-based treatment. As in previous edition, extensive case material is used to illustrate key points of diagnosis and treatment. Len Sperry, MD, PhD, is a professor of mental health counseling and director of clinical training at Florida Atlantic University, and clinical professor of psychiatry at the Medical College of Wisconsin. For more than 3 decades, he has treated and taught courses and workshops on the personality disorders. Among his 1,000 plus professional publications are several articles, book chapters, and books on these disorders, including the recently published Cognitive Behavior Therapy of DSM-5 Personality Disorders. Len Sperry has been a leader in the treatment of personality disorders for over 25 years. This third edition of his handbook provides treatment strategies informed by recent research and updates from DSM-5. Sperry is the top contemporary clinical scholar of personality disorders with his integration of empirical science, human development, and a synthetic understanding of different treatment approaches. If you are going to purchase one book on personality disorders, get this one. Stephen J. Sandich, PhD, LP, Professor of Psychological and Brain Sciences, Boston University. As a much-needed antidote to the one-size-fits-all of current cognitive therapy, be it for axis first or axis second, Dr. Sperry has presented a much-needed series of evidence-based and tailored interventions that effectively treat the gamut of personality disorders that are so prevalent today. Nicholas A. Cummings, PhD, SCD, former President, American Psychological Association. The Handbook of Diagnosis and Treatment of DSM-5 Personality Disorders, Assessment, Case Conceptualization and Treatment, 3rd edition, is a must-read for any practicing mental health clinician working with personality disordered clients. It is remarkably practical, user-friendly, updated, and helpful to assist both professionals and trainees alike stay up to date on the thoughtful evidence-based strategies for understanding and treating personality disorders. This is one of those books that should be on the shelf of all mental health professionals. Dr. Sperry, as usual, has offered the profession a terrific update to his now classic text. Thomas G. Plant, PhD, ABPP, Professor of Psychology, Santa Clara University. Len Sperry's 3rd edition of the Handbook of Diagnosis and Treatment of DSM-5 Personality Disorders offers both the experienced clinician and student a concise overview and description of the range of personality disorders, as well as presenting the essential elements of comprehensive diagnosis and treatment. Sperry understands the world of the clinician, distilling the theoretical and pragmatic advances in clinical science that offer hope for identifying, conceptualizing, and more importantly, influencing the course of change for these ubiquitous and challenging disorders. Jeffrey J. Magnavita, PhD, ABPP, independent practice and a lecturer in psychiatry, Yale University. Sperry's third edition of this benchmark handbook makes it the instant standard on the assessment and treatment of personality disorders, evidence-based yet delightfully reader-friendly. Sperry's guide blends a scientist's mastery of the evidence with the healer's empathy for the pain and disruption that stalk the lives of the personality impaired. Jam-packed with case examples and practitioner-oriented recommendations. This is a must-read for the competent clinician. W. Brad Johnson, PhD, Professor of Psychology, U.S. Naval Academy and Johns Hopkins University. To provide effective short-term and enduring treatment, it is necessary to diagnose and treat the personality of the client. Len Sperry, MD, PhD, provides the insight and guidelines to make this once considered impossible task likely. The book is chocked full of practical suggestions and tools that aid the diagnosis, conceptualization and treatment of personality disorders following the DSM-5 guidelines. The third edition of the Handbook of Diagnosis and Treatment of DSM-5 personality disorders belongs on every clinician's bookshelf. If you read only one professional book this year, this is the one. John Carlson, PSYD, EDD, ABPP, Distinguished Professor of Adlerian Psychology, Adler University, Chicago. Unlike many writers who help the reader understand personality disorders, Sperry helps the reader understand personality disorders and, more importantly, how to help those who struggle with them. with the changes in the DSM-5 related to the understanding and treatment of personality disorders, Sperry's work is cutting edge and a must-read for all clinicians. Craig S. Cashwell, PhD, Professor of Counseling, University of North Carolina at Greensboro. The third edition of Dr. Sperry's Handbook demonstrates the strength of the previous edition. It is clearly written, comprehensive, up-to-date, and jargon-free. Its biopsychosocial approach to the personality disorders is realistically optimistic while adhering to evidence-based treatments. Finally, Dr. Sperry is clearly dedicated to listening with the third ear, which is essential in working with personality disordered patients. Ronald W. Peace, MD, Professor of Psychiatry, lecturer on bioethics and humanities, SUNY Upstate Medical University. Personality disorders are the most misunderstood and misdiagnosed of all of the DSM-5 ICD-10 mental disorders. Here, in this easy-to-read handbook, Len Sperry presents the most user-friendly guide available to personality disorders, coupled with a completely integrative model to case conceptualization. A book for every graduate psychopathology course in the nation. James Robert Bitter, Ed.D., Professor of Counseling and Human Services, East Tennessee State University. There's an old myth that personality disorders are equivalent to a life sentence to psychotherapy. Len Sperry uses scientific evidence and a logical analysis to systematically bust this myth. If you are interested in working with clients with personality disorders, this book is indispensable. Not only does Sperry offer hope and optimism for positive outcomes, he also deftly summarizes many evidence-based approaches that can transform your optimism to clinical reality. John Summers Flanagan, PhD, Professor of Counselor Education at the University of Montana. Len Sperry, MD, PhD, is a brilliant writer who, with his psychology and psychiatry background, is able to capture nuances in cognitions and affective and interpersonal styles of individuals with personality disorders in a way that crystallizes the concept for the reader. The wonderful case examples and understanding the parental injunctions and world view perspectives of the patient were especially helpful for me. This book is an incredible manual and reference book. I still have one of Dr. Sperry's first books on personality disorders and still reference it to this day. John A. Lerman, MD, chairman of Charles E. Kubley, professor of psychiatry and behavioral medicine, Medical College of Wisconsin. A tremendous resource, including the latest DSM-5 descriptions, cross-theoretical conceptualizations, and integrative treatment approaches for all of the identified personality disorders under one cover. Sperry neatly addresses the categorical versus dimensional assessment dilemma by expertly contrasting each personality disorder with its corresponding subclinical personality style. Sperry's captivating clinical dignities combined with his presentation of empirical evidence to create a most satisfying volume for the interested scientist practitioner. Corey F. Newman, PhD, ABPP, Professor of Psychology and Psychiatry, Perelman School of Medicine, University of Pennsylvania. Handbook of Diagnosis and Treatment of DSM-5 Personality Disorders. Assessment, Case Conceptualization and Treatment. 3rd edition. Len Sperry, MD, PhD. New York and London. third edition, published 2016. New York. Contents: foreword, preface, acknowledgements. The first, diagnosis and the treatment of personality disorders today. The second, case conceptualization and the effective treatment of personality disorders. The third, antisocial personality disorder. The fourth, avoidant personality disorder. The fifth, borderline personality disorder. The sixth, dependent personality disorder. The seventh, histrionic personality disorder. The eighth, narcissistic personality disorder. The ninth, obsessive compulsive personality disorder. The 10th, paranoid personality disorder. The 11th, schizoid personality disorder. And the 12th, schizotypal personality disorder. Reference index. Forward. As a new graduate student in psychology at New York University in 1964, I took the required course in psychopathology. The instructor quoted liberally from a volume he called the Diagnostic and Statistical Manual, or DSM, published by the American Psychiatric Association in 1952. We immediately asked if we could purchase the thin spiral-bound book at the bookstore, but the instructor told us that access was limited to psychiatrists and that only they could use it to diagnose and a patient. He had clearly gotten the volume under false pretenses or through some subterfuge. While we did not think that was fear, as new graduate students we recognized the pecking order in mental health. The psychiatrist was at the top, and psychologists were not ordained to read or use the holy words of the DSM. This first edition was not labeled as DSM first, simply DSM, with no portent of what was ahead. In DSM first, all mental disorders were divided into two major groups. The first, those in which there is a disturbance of mental function resulting from or precipitated by primary impairment of the function of the brain, generally due to a diffuse impairment of brain tissue, and the second, those which are the result of a more general difficulty in adaptation of the individual, and in which any associated brain function disturbance is secondary to the psychiatric disorder. In brackets, page 9. The DSM, as might be expected of the zeitgeist, was suffused with the contemporary perspective of psychoanalysis. The descriptions were brief and still left a great deal of room for clinician interpretation and creativity. It was not until 1968, with the publication of the second edition of DSM, labeled DSM Second, that there was a sequencing of editions noted. The only place that we could get the DSM Second was at the medical school bookstore. We gave one of our graduate cohort the money, and they did a DSM Second run and got copies for all of us. We never asked what lies he had to tell to get by the eagle-eyed cashiers at the bookstore. By 1980, I was practicing a licensed clinical psychologist when I was confronted by the most horrible event I had yet encountered in my career. The third edition DSM, the third, was published. The sheer weight and size of this new volume had me thinking that I needed to leave clinical psychology. There was no way that I could learn all of this new information on or become knowledgeable in this new diagnostic format. The diagnostic descriptions in DSM first ran to 31 pages. Pages from 12 to 43. For DSM Second, there was an increase to 38 pages in length. Now in DSM Third, the diagnostic descriptions ran to 300 pages. Who were these people to do this to the field? Who amongst us could master this tenfold increase in material? By 1980, psychologists could obtain the DSM and use it for diagnosis. There were some excellent additions, including the idea of a multi-axial diagnosis. In the good old days, one could make up one's own diagnosis with some impunity, using mixed formulations including dynamic, behavioral and mythical ideas. By 1980, however, there were established limits to what we could use as diagnostic statements. Some of us were troubled by these strictures. Others were comforted by the boundaries. If a patient did not meet criteria for a particular diagnosis, they could not be diagnosed with that disorder. If, however, the patient met the minimum criteria, whether the clinician liked it or not, the patient could earn that diagnosis. As I taught my students, if it looks like a duck, walks like a duck, and quacks like a duck, it is likely a duck, not a dog that has learned a foreign language. A critical change in DSM-5 was the idea of diagnosing an individual on 5 separate and distinct axes. This multi-axial diagnosis allowed the clinician to identify and code aspects of the environment and areas of functioning that might be overlooked if the focus was on assessing a single presenting problem. In brackets, page 23. The 5 axes were: axis first, clinical syndromes; axis second, personality disorders, specific developmental disorders; axis third, physical disorders and medical health problems; axis fourth, severity of psychosocial stressors; axis fifth, highest level of adaptive functioning in the past year. A non-axial category would be used when conditions are not attributable to a mental disorder, but were still the focus on attention or treatment, in brackets, occupational problems, marital problems. These were coded as 5 codes. In 1994, the 4th edition of DSM was published, in brackets, DSM the 4th, where the definition of terms had swelled to an astounding 650 pages. The description of antisocial personality disorder was the same, though some criteria differed from DSM 3rd R. DSM 4th TR was published in 2000. The criteria sets were generally unchanged, but there was a substantial revision of the descriptions, features, cultural factors, age, and gender differences, associated features, prevalence scores of the disorder, familiar pattern, and differential diagnosis. The definition of terms now covered 703 pages, almost 23 times the number of definitional pages in DSM first. Finally, the long-awaited and much heralded publication of DSM-5 occurred in 2013. Definitions now take 775 pages, again an almost 10% increase. There have been changes in many realms, but few, if any, changes in the criteria and descriptions of the personality disorders. Given that the patients with personality disorders are often among the most difficult to treat and take more work and energy on the part of the therapist, all without the same treatment success, they can take a major share of the therapist's time and focus. While there has been disagreement with the categorical approaches taken by DSM and ICD because of its labeling or pigeonholing potential, these volumes represent the commonly used diagnostic schema for the range and breadth of mental disorders. The approach of DSM has been criticized as cumbersome and even of driving medical students from considering a career in psychiatry. It is not our goal to argue the value of the DSM, the dispensing with the multi-axial system, or the accuracy of criteria. In our view, probably a far greater issue in the use of both DSM and ICD is the lack of operational definitions in both of these diagnostic schemas. A reading of both volumes would find that many terms are self-evident and need little explication, e.g. that first criterion in DSM-5 for borderline personality disorder states frantic efforts to avoid real or imagined abandonment. The words effort, avoid, real, and emergent need relatively little clarification. The terms frantic and abandonment are, however, quite vague and open to interpretation. Given the lack of agreement on all terms, it should also be noted that over 200 combinations of criteria can be used to meet the required number of criteria to arrive at a diagnosis of any personality disorder. To add to the diagnostic confusion, the International Classification of Diseases, ICD, published by the World Health Organization, is presently preparing its 11th edition, plus the Psychodynamic Diagnostic Manual in brackets PDM, a collaborative effort of the American Psychoanalytic Association, the International Psychoanalytical Association, the Division of Psychoanalysis of the American Psychological Association, the American Academy of Psychoanalysis and Dynamic Psychiatry, and the National Membership Committee on Psychoanalysis in Clinical Social Work was published in 2006. According to the overview offered by the authors, the PDM is a diagnostic framework that attempts to characterize an individual's full range of functioning, the depth as well as the surface of emotional, cognitive, and social patterns. In brackets, page 1st. Given the lack of coherence, the confusion regarding diagnostic entities, and the issues regarding cohesiveness, what has become a necessity is a single volume that can explain and put the pieces in order. To do this requires a clear vision of what personality disorder is, how it can potentially impact on an individual and that individual's family and cultural system. It requires a clinical understanding of multiple treatment models and the ability to apply the diagnostic understanding into clinical practice. It requires the author to be able to engage the reader on 7 different levels: the diagnostic, the theoretical, the strategic, and the technical. The third edition, Len Sperry's Handbook of Diagnosis and Treatment of DSM-5 Personality Disorders, Assessment, Case Conceptualization and Treatment, has all of these and more. The first 2 chapters need to be included in a bound monograph that would be required reading for every graduate course in psychopathology. Chapter 1 on the diagnosis and treatment of personality disorders offers not only the historical perspective of personality disorders, but addresses the development and maturation of the clinical view of the disorders and the treatment of the individuals whose behavior, mood, and style have earned them membership in this small but important group. After reviewing the changes that have gone into the current revision of DSM, Sperry introduces the clinician reader to the diagnostic schema that has become the required model. Sperry describes the substantive issues of comorbidity, heterogeneity, and an understanding of the construct of personality. We can easily recognize that individuals have personal style that may be emblematic of how they respond both interactively and intrapsychically. It is when the style impairs function or results in maladaptive behavior that the style becomes a disorder. Of value to the novice. Novice and the experienced clinician of whatever stripe the discussion of the alternative model of personality disorders is of special value. The constructs of personality functioning and personality traits are viewed dimensionally as levels of impairment, from no impairment to mild impairment, moderate impairment, severe impairment, and extreme impairment. The discussion of personality styles and disorders in regard to the individual's attachment style is of great use for both diagnosis and treatment planning. Most clinicians view the patient in regard to the phenotype, how the patient looks to others and how the behavior is described via the criteria sets. Sperry makes the case for the importance of the genotype, the temperament and neuroscientific base, but also describes the patient sociotype, the cultural and family attachment style. The review of the various empirical supported models for treatment offers the reader a survey of what is available. This alone is worth the price of admission. The discussion of Sperry's pattern-focused psychotherapy is an excellent combination of several models, but sets itself aside by its strong allegiance to a DSM-5 understanding of the personality patterns and styles. Sperry's broad-based scholarship includes his discussion of transference-focused psychotherapy, mentalization-based treatment, schema therapy, and development therapy. In Chapter 2, Sperry tackles what is the most sophisticated and difficult part of the overall treatment process: the assessment and conceptualization of the style and disorders. The best therapists are quite a bit like Sherlock Holmes. They are well versed in several theories, in brackets, not that they have to practice them all. They understand the historical issues for the client, patient. They work to develop an understanding that includes the patient's cultural experience and can build a coherent model of the patient that they can then test with macro interventions. Macro interventions. The sequence of data collection and conceptualization are areas in which Sperry excels. He takes the clinician on a step-by-step journey that ends in the clinician actually understanding why one set of interventions has a greater likelihood of working as opposed to another set of technical interventions. His clinical examples give clarity and substance to his discussions of treatment and give the reader insight into Sperry's clinical thinking. Few texts give such a clear and attentive discussion of this complex in brackets and essential behavior. In his discussions of each of the disorders, Sperry uses the same template for each chapter, which makes it an easier read for the reader and of maximum use to the clinician. In my therapy work, I am a strong believer and use of story, parable, metaphor, and myth. In reading through the manuscript for this text, I realized that there was a character dancing at the back of my mind. I finally realized who it was. A story retold by the brothers Grimm was about the character named Rumpelstiltskin. He had the ability to spin straw into gold. That is, in effect, what Sperry has done with this tour de force volume. Len Sperry has taken the diagnostic straw of 60 plus years of DSM, ICD, and PDM and has spun it into clinical gold. Art Freeman, co-editor, Cognitive Therapy of Personality Disorders, 3rd edition. This. Okay, let's stop here and we'll continue the next time.